Margaret Harris is the communications manager for the World Health Organization's operations in Goma. She said workers are concentrating their efforts on Congo's borders.
If you've got healthy people who are crossing borders, for instance, this is very important, and we've got huge numbers of teams working at what we call points of entry, and this is done by our partners, the International Organization for Migration, and they check everybody's temperature, and they insist that everybody who crosses every border washes their hands and also gives their name and where they're from, so that should there be an outbreak, should they find that there's transmission, they can work out who's crossed the border and where they've gone. The temperature check sounds a bit basic, but actually that's the first symptom of Ebola. And if you see somebody with a high temperature, now it could be malaria, but immediately they need to be checked and tested to ensure they don't have Ebola. The other thing that's done is people who've been in contact with somebody who's got Ebola is identified and asked to make themselves available for 21 days to be checked every day, usually by people in the local community. What we're trying to do now is work very much with local communities and get the local communities to nominate people they trust to be in charge of looking after and looking out for Ebola, so that it's not a case of foreigners like me coming along and imposing what I think is right. It's a matter of communities deciding how to stop this virus.
What are some of the challenges that you and your team and the medical community as a whole is facing in the effort to contain this?
Well, you're quite right to raise the challenges, and interestingly, it was what I was just talking about, getting communities to really accept, first of all, that this is a very serious disease that they want to stop, not something that we've invented because for some reason we've decided to come here. And secondly, that to trust the treatment that you can get in an Ebola treatment centre. We're still finding that people don't believe that they can get good treatment. They still seem to think that going to an Ebola treatment centre is like a death sentence. In fact, if they get there early at that stage when they've simply got a fever, they've got a really, really good chance of survival, up to 90% chance of survival. Whereas if they come late, if they come 7 days after the symptoms have started, we really can't do much to help. That at that point they have a 90% chance of dying, and they've also probably infected family, friends, neighbours, all the people they care about. So really getting that message across, getting people to believe that it's in their interests and their community's interests that they identify themselves as having Ebola is really the major challenge.
Talk to us about the second vaccine and the opposition to it.
There's not so much opposition. It should be understood the second vaccine is only at the stage where it's had safety testing. It's been shown to be a very safe vaccine, but it is not at the stage where we know it works where there's active Ebola. Unfortunately, the only way to know that is to use it where there is active Ebola. And we were able to test the current vaccine in Guinea. We designed a trial that meant everybody could get tested, but some people got treated with the vaccine. But some people got treated immediately and other people got treated with a delay. And when that test was done, remember, we didn't know whether it worked. So ethically, you could provide this vaccine. And when we saw that those who were given a vaccine with delay did not do as well as those who got it immediately, we stopped that trial and provided the vaccine to everybody. Now, in this case, we've got a number of candidate vaccines, all of them promising, but the problem is we don't know that they work, and we do know that the current vaccine does work. So it's a very hard ask for a population who are facing this terrifying disease to say, we're going to give you a different vaccine that we don't know whether it works. We know it's safe, we don't know whether it works. And given what I mentioned before, the issues of community trust, it's going to be very hard to communicate to people that a vaccine we don't know that works is the one that can be trusted.
Margaret Harris there from the World Health Organization.